My name is Ringzi. This issue is important to me because the Marshall Islands, its people and its cultures, is being forgotten due to the United States' lack of awareness as well as a commitment to the people who are affected by the nuclear test.
Hi, my name's Hans Nostine, and this issue is important because one of the worst things that you can do to your friends is forget about them.
My name is Rachel, and this is important because the Bravo Castle bombings and Experiment 4.1 was amongst the most violent acts against humanity, and the U.S. must take responsibility for it.
Our group was focused on healthcare policy in the United States. The reason for this focus is Marshallese often face unfair obstacles when trying to access healthcare in the United States. And to understand that, I'll give you a quick history lesson. The Marshall Islands were previously under administrative control of the U.S. through the United Nations Trust Territories of the Pacific Islands. And that ranged from 1947 to 1986. In 1986, the United States entered into a compact of free association with the newly formed Republic of the Marshall Islands and the Federated States of Micronesia, establishing those two countries as independent. In 1994, the U.S. Entered into a similar compact with the Republic of Palau. And so what this did, the compacts all essentially did the same thing. They granted each state its sovereignty. They also gave the U.S. military control over 2 million square miles of ocean and land that composed the three states. And it established a special relationship that gave special immigration rights to citizens of those three nations. And the compacts in their texts outline that they're meant to kind of celebrate this special relationship. It is a unique relationship from a unique history we're celebrating. And so for COFA citizens, the compacts allow them to freely enter into the U.S., to seek work in the U.S., to reside as long as they like legally, and this is, again, in recognition of the special friendship that the U.S. has had with these nations. And when these citizens do that, when they live and work in the U.S., they pay state taxes, they pay federal taxes, taxes for Medicaid. But then, and under the compacts, they previously had access to federal health programs. But in 1996, President Clinton signed the Welfare Reform Act that actually disqualified COFA citizens. And since then, they've been struggling to receive access to healthcare in the U.S. Very wrongfully. And that kind of catches you up.
Right. So in order to tackle this problem of where the Marshallese community have no access to Medicaid, our group specifically focus on the toolkits that would be able to, beside raising awareness, also gather the interest of policymakers. So we did an educational pamphlet. So basically it includes the problems, what's going on, and why are they excluded from Medicaid. And we also mentioned what are being done and what can be done to help. So basically the pamphlet just have everything, the most basic information you could find about the issue. And we also did a letter, which is basically supposed to, I guess, raise awareness, get the interest of legislators and other policymakers. The letter basically pretty straightforward, a one-page memo, and then along with that we have a more like in-depth analysis of like why this letter is important and why they should read, more statistic, more image, and more of like a humanizing the issue itself. So we also include like interviews, like excerpts of the Marshallese community. So basically what we did was write the letter, one-page letter, and then that mentioned if you want more information regarding this issue, please refer to the attached document, which basically have all that information.
And even though this is a lot of information, it's really important to realize that the Marshallese come from a very rich and strong culture, and that there are human lives attached to all of what we're talking about. Even through all of these health disparities, the Marshallese have stick together and still held on to their societal values as kindness being one of the main components of sticking together. And it's critical to help these people as as we try to get them easier access to healthcare. Even though they've been done wrong so many times, it's for so long, they still stay hopeful and kind to those that are helping, even those who haven't helped. So it's important to realize that these are real people